Welcome to the webinar. My name is Robin Texera. I'm an associate at CIBHS, and we are pleased to be offering this webinar on the importance of integrated healthcare in connection with the Health Workforce Initiative. And as you can see, Kristen Dempsey is our presenter, and I am going to stop talking and let Kristen take over.
Great. Thank you so much, Robin. Hello, everyone. Welcome. Excited to be speaking with you from San Francisco again today. And this is the third and final workshop in this series, and it's on the importance of integrated care. So we'll spend a little time talking about integrated care, what it is, why it's important, all those good things. And I know with an hour and a half, it's tough to sometimes have all the time we like just to talk and chat. So I'm hoping to have some time at the end to actually just answer questions, all kinds of questions that you might have, because we've done a few webinars in this series. I did motivational interviewing last month and other things. I know people are really interested in some of kind of best practices in behavioral healthcare and integrated care and training and teaching and developing the workforce. So hopefully we'll have a little time at the end. We'll see how all this goes. Thank you so much for adding the chat box, kind of where you're from and what you're up to. And I don't know if we have any students in the audience. We may or may not. It looks like we have folks out there doing great work in the field. So welcome. It's lovely to have you. And I'm just going to share my screen. I had a lot of fun putting this together, this particular discussion on integrated care, integrated healthcare. So I'll start off just a little bit about objectives. Go a lot of directions with this, right? So I was trying to think about, of course, audience and HWI and the types of work that folks are doing out there. So I really started to think about what is integrated care and some of the models. There's definitely some different models. Don't want to get into too deep into all the various details about that, but just give you some ideas of how this is being thought about. And I'm going to talk a bit about behavioral health, because that's kind of the area that I have the most expertise in, and not more than a few slides about some of the issues in behavioral health, how we're missing the mark in terms of really getting access to the folks who need it, which right now is a critical issue. And we're working on this or hearing about it every day about how many folks are needing behavioral health services and how this is just not happening. But a lot of it has to do with workforce. I'm teaching a graduate program for counseling psychologists, actually for master's level counselors in counseling psychology. And you used to be, you graduate, be, a while to get your associateship and to get hired. It was always challenging and competitive. And we have students being just snapped up months before they graduate. They're already interviewing now before they graduate, which is excellent for them. It's a wonderful change. But it's also speaking to the fact that we're really struggling to get these services to folks. And I'll talk a little bit about how integrated health might be an important aspect of broadening access points for folks. And I'll talk a bit too about how to look for jobs, not say jobs, but like job requirements on ONET. And some of you might be familiar with that site. I'm sure you are. Maybe all of you are aware of it. But I'll just do a little peek into that, just give that as a resource. And then I'm going to spend a chunk of time really looking at what are the knowledge, skills, and attitudes that workers need to develop in order to be great at integrated health, right? It's a different type of model. And historically, providers in healthcare have been training separately, and there's often overlap in our work. Sometimes we work together, but this is a very intentional bringing folks together. And there's some rather important large skill sets that we need to share in terms of flexibility and openness and just the kind of style that we work, and the style that helps support the aims, but also supports the culture of integrated care. What I do like to do as I'm talking is I like to invite you at any point to enter information into the chat box. So again, it's wonderful to see all over the state. It's great to see where you're all from and the types of things you've been attending. And please, by all means, you can also raise your hands. There's a reaction key, the little smiley emoji down at the bottom of your Zoom doc. You should be able to click on that and raise your hand. That puts your little face and hand up in front of me so I can see you. And so we'll just get started. First of all, just get started with the basic definition, and then I have a video. It is a cute video. It's like a 6-minute video that just paints a broad brush of what is integrated behavioral health. But I think it's useful just to get us all on the same page. So what is integrated healthcare? I like this definition, probably the best. I searched around for a number of different definitions. And it's a care that results. So it is, this idea of being very intentional. When we have a practice team of primary care and behavioral health clinicians, although it can include other providers as well. Sometimes it pulls in dentistry. Pharmacy can also be pulled in other parts of healthcare that aren't always represented in a primary practice team. And it's just working together with patients and families using a systemic and cost-effective approach to provide person-centered care for a defined population. So again, it talks about here, it could address mental health and substance abuse conditions. That's what I'll be talking about a bit. Health behaviors, including their contribution to chronic medical illnesses. And it's an important component to think about in terms of overlap, but also the behavioral issues that we just have and that impact our management of our other health behaviors. So helping people with behavioral targets around chronic healthcare management, for instance. Life stressors, crises, stress-related physical symptoms, and ineffective patterns of healthcare utilization. So it's looking, again, more systemically about what are the chronic sources of stress for individuals and communities. The integrated care can play a big role too in some of our larger environmental challenges we have, not just around issues of access to care, but also the chronic stressors that many of our communities are having now around issues such as pandemic, climate crisis, things that can keep occurring that are resulting in chronic physical and emotional health care stressors and illness. And this idea of effective healthcare utilization, I'll talk about that a little bit. This idea of not just providing care, but providing care in a way that's very intentional. And it's very much about, is this efficient? And if it's not, how do we work with that? So that's an important aspect of behavioral health care integration as well. And I'm curious as you watch this too, just any of your impressions as you're thinking about this in terms of, the culture of the care provision, what comes up for you. Just kind of think about that. Feel free to add things into the chat box. Like what's your first impression here about integrated care? And let me know if you have any concerns about hearing this. Oops, just lost my cursor. There we go.
When it comes to healthcare, there are many ways to get care. There are organizations that provide different care for different needs, like primary care centers, ERs, dentists, pharmacies, and behavioral health centers. When you have multiple health issues, you traditionally have to set up multiple appointments with these different specialists. Sometimes, people get help for only some of their concerns. When that happens, it's hard to get well. Although certain concerns may seem unrelated, they are all part of a whole person, a system, and it's hard for the person's healthcare provider to help them reach whole health and wellness unless they are aware of and know about all of the concerns. When they know all concerns, they can help the person decide which options for care may be more effective. There's a new approach, integrated healthcare. For people with multiple health concerns, including mental illness and addiction, healthcare providers are adopting integrated care practices. That means they are teaming up with other healthcare providers to increase access to primary and preventative medical care, mental health care, addictions treatment, and sometimes dentistry, offering coordinated care, sometimes even in the same office. Community health centers and behavioral health centers are beginning to work together to provide services as a team and screen and refer people to each other's office for the services needed. A growing number of integrated care providers are in the same building. What does integrated care look like? Let's take a look. Meet Wendy. Wendy doesn't feel well. She has diabetes and bipolar disorder. Lately, Wendy's been sad and drained of energy. Last month, Wendy was in the hospital for complications from her diabetes. Now, she needs to refill her medications and wants to see someone about how she's been feeling. She could go to a health clinic to see a doctor or nutritionist for her diabetes, a separate behavioral health center to see a counselor and psychiatrist for her bipolar disorder, and then head over to the pharmacy to pick up her medications. This time, Wendy is going to a place in her neighborhood where she can get primary care, mental health care, and addictions treatment. When Wendy gets to the center, she meets Renita, the receptionist. Renita helps Wendy enroll in the center's care. Wendy tells Renita about how she was just in the hospital, and she tells her why she's come in today. Wendy explains how depressed she feels, how she wants to talk to a counselor, how she needs a psychiatrist for her mental health medication, and a doctor for her diabetes. Renita gives Wendy a screening form where Wendy shares that she drinks heavily but would like to stop. Renita explains to Wendy how at their center she will have a caring team of professionals all at the same location to help her achieve her health goals. Renita then introduces Wendy to Nathan, the nurse. Nathan takes Wendy's blood sugar and is alarmed at how high it is. Wendy explains that she hasn't checked her blood sugar for a week because she doesn't own a blood sugar monitor and can't afford one. Wendy tells Nathan that she'd like to know how to take better care of herself. Nathan checks with Wendy's health insurance and sets up an appointment for Wendy to see a doctor on that same day. Wendy then sees Dr. Dynamite. Dr. Dynamite gives Wendy a physical, and while she's doing that, Wendy talks with the doctor about her bipolar disorder and diabetes. Dr. Dynamite is concerned about Wendy's worsening symptoms of depression and steps out of the room to call a consultant psychiatric provider who suggests an increase in Wendy's antidepressant medication. She then writes Wendy a new prescription for her diabetes medication and the change recommended by the psychiatric consultant, and suggests that Wendy meet with her colleague Louise to talk more about her bipolar disorder. Dr. Dynamite indicates that she will also talk with Louise about Wendy's diabetes so that everyone is on the same page. She asks Wendy to check in with Nurse Nathan every day that week so they can together monitor her blood sugar. While Wendy is waiting for Louise to come into the exam room, Nathan talks with Wendy about managing her blood sugar, eating right, gives her tips to drink less, and advises her about her medication. Nathan then introduces Wendy to Louise, the center's licensed clinical social worker. Wendy feels comfortable enough to share her experiences and talks with Louise about her recent symptoms. Louise asks Wendy if they can meet on a weekly basis to start. Louise asks Wendy if she'd like to meet with Pia, a peer counselor. Louise explains that peer counselors are individuals on the care team who have experienced getting help for a mental health or addiction concern themselves and are trained in helping people who are working toward recovery just like they have. Wendy agrees that she would like to meet with Pia. Louise also gives Wendy a list of some nearby support groups that can help Wendy reduce her drinking. Nathan, Louise, Dr. Dynamite, and the other professionals that help care for Wendy at the center each know the outcomes of their visits with Wendy in one electronic health record. Before she heads home, Wendy chats with Nathan, who will work with Wendy to ensure she continues receiving regular care. Then there's just one last stop. Wendy stops by the on-site pharmacy to pick up her prescriptions. All of Wendy's new caregivers talk about Wendy's progress in regular morning meetings. Nurse Nathan regularly checks on Wendy to make sure she has what she needs to manage her health and to feel better. Wendy is more confident in talking about her behavioral health and medical issues with Nurse Nathan, peer counselor Pia, and LCSW Louise. They see Wendy regularly to make sure she's feeling better and educate her how diabetes can sometimes worsen feelings of depression. Wendy now checks her blood sugar daily, takes her medication on schedule, and eats carefully. She is drinking less each week and is talking about giving up alcohol altogether. She attends a nutrition class at the center and walks every day to lose weight and to help control her diabetes. Her blood sugar is controlled, and with counseling and support, her symptoms of depression are reduced. Since starting this new integrated care, Wendy hasn't had to visit the emergency room or go into the hospital. Wendy is on her way to wellness.
Apologies for that. Thank you for that. I know that's a rather rapid fire little introduction there to integrated behavioral health, but I'm just wondering, just for the group, just what kinds of things came up for you as you were watching it. It could be around the pacing, it could be around content. Just what did you really notice about it? What was kind of the difference? Yeah, it does give a really nice overview of how much goes into. I'm looking at Irene's comments here, just how much goes into really doing whole person health. I mean, we have a lot of moving parts and a lot of different pieces that we're constantly working on, and it's so difficult for any one provider to kind of catch all those, or even for one individual to kind of go to all the different places they need to go to. Most of us are still receiving our care in a non-integrated way. You know how it is. It's like trying to make appointments for a bunch of different things and make it for your kids and your other family members. Yeah, it certainly does make it a lot easier for individuals, um, especially with individuals with complication issues, which um, is a number of folks who might be relatively small in some cases, but they accrue, well, certainly accrue a lot of services and need a lot of care. And unfortunately, the more kind of complicated it gets, the harder it is for those individuals. Someone who does have bipolar disorder, maybe drinking issues as well, and any all number of like physical issues, the more complex it is, the harder it is for them to physically sometimes get to all the different places they need to go. So this is really, one of the only ones that really makes sense, kind of provide that kind of care. Yeah, it's absolutely stressful from going to place to place, absolutely. And you're right, Jennifer. It's the collaboration coordination is a really important part. I'll talk about that a little bit later in terms of core competencies, because we're thinking about what kinds of training we're acquiring for maybe people we're teaching. The folks who are most interested in that aspect of leadership, like real collaborative leadership, and that ability to think systemically and to view large pictures. Maybe even people who love that challenge of trying to figure out flow. Right? Worked a lot. Some of my first jobs were working in places where we had to deal with clinic flow. And I remember, this is many, many years ago, but being told by one of our consultants, like clinic flow, it's never resolved. You're always working on, trying to, have it be smoother. There's always something that frustrates it. It's just an ongoing process. But absolutely, in this video, it makes it seem pretty easy. Of course, a little 6-minute, little very sweet animated video, but it to make things run smoothly. And a lot of integrated care centers run amazingly smooth for all that they got going on. It takes work. It takes a lot of teamwork. Great. Anything else? Comments? Okay, not seeing any. I'll go back to sharing here. So I said at the top of the hour, I was going to talk a little bit about behavioral health. I won't spend too much time here. But one of the challenges with behavioral health, consistently has been, how do we, just as systemically, really have hold behavioral health like more accountable and really, create more improvement. And I think a lot of times this is even, a beyond, like say individual, say like county system or individual provider. It's like it's a larger, it's a whole kind of healthcare structure in so many ways. Because of the way behavioral health is funded, and it's like disintegrated and many times kind of capitated types of services. Like it gets really, really difficult for access. It gets difficult for the leadership administration to actually provide all that they want and need to provide. And so integrated care was really thought of as an important solution for the behavioral health gaps, especially when they started to look into the Affordable Care Act and started to think about, especially with the A in affordable healthcare, like how to make this more affordable and how to make it more accessible. So some of you may have seen this, like the 55, I think 50% 5%, with this idea that the top 5% of folks in our healthcare systems often end up, not to blame them, of course, but often end up with like 50% of expenditures in a particular way, just because they have so many kind of chronic co-occurring conditions. And there's a lot of, kind of going back and forth and not being able to communicate about these conditions. So conditions get worse. And there's, need for like high-end care, because if something's not attended to, what happens, of course, people end up in emergency rooms, which gets higher and higher, more expensive. And there are a lot of things out there that people have that we could be dealing with on a consistent basis in an integrated setting, like ongoing substance use, like ongoing traumas. Traumas is a big one, ongoing like diabetes care, and related aspects to that, things like ongoing, say asthma. I mean, these things that are constantly kind of in the background, but that when they go untreated, make other things worse, or they themselves become very expensive to manage and expensive for the system. But clearly, to me, the worst impact is just so difficult for the individuals and their families. I also put this in here too, just because thinking about behavioral health kind of being out there as kind of a separate specialty kind of service, and yet it's so prevalent. Like it just really the fact it's so prevalent on that level just needs to. Sorry, I'm trying to got tied around here myself. Just needs to be brought into the mainstream of healthcare, right? So instead of being something separate you have to go to, it should be something that's dealt with all the time. And this is from a book from 6 years ago. It's a great book. It's already getting to be a bit out of date because we know with the pandemic, especially with my column on the right, thinking about adolescence, a lot about adolescence in the pandemic, the issues like around anxiety, depression, suicidality is really ramping up. New York Times just had an article, big Sunday kind of spread on it this last week that garnered a lot of attention. But if we're thinking about all these youth, for example, here on the right, with fear disorder, distress disorder, so these are large categories. These aren't the DSM, clearly, not the DSM specific categories. But we're looking here, we have at least, a quarter of our youth having like either fear or distress. Probably these are overlapping. I think the behavior disorder here, we're talking about, issues around, behavioral issues like defiance, those types of things, oppositional type stuff that might be part of treatment. Substance disorder, about 11%. Substance use disorder among youth has dropped in the last 10, 15 years. However, the other mental health disorders are what's on the rise. So anxiety, depression, and suicidality, all those pieces are needing to be addressed. So all these youth, presumably, or many of them, like will see doctors, will have pediatricians and such, and yet how much of this is being addressed? How much of it can be addressed in the current model that maybe many pediatricians work in, right? That could be really challenging. Although I can say as a therapist, I do know there's a lot of doctors, without a lot of support, really trying to address these issues with young people. And then the left-hand slide here is just about the prevalence of just co-occurrence, if you will, of behavioral health conditions. So it's not common for people to have 2 or 3 or more disorders. Again, with all of that increases complexity, and with that complexity, the impact on physical health also increases as well. I thought this was an important piece to think about as well. So when we're looking at drug addiction, mental illness, and poverty often accompany underlying high use behavior. So we're talking about high use of healthcare systems, particularly in patients without end stage medical conditions. So there's people just chronically for decades, kind of coming in and getting a lot of services, but maybe not having anything being treated well. And care plans and care management are the most effective ways to start to manage costs. Again, it's not like costs are necessarily always a top priority, but it's certainly a large priority because the more costs are managed, the more care we can provide. And again, it's just these things come together, right? Good care and cost management. Another thing to think about here, and I'm interested, because I have a number of people in the audience, sound like they're from behavioral health organizations. One of the challenges that also has occurred just historically, and this is certainly changing around how behavioral healthcare has been provided. And so in the last couple of decades, certainly there's been a lot more emphasis on delivering evidence-based care, but it's still, I think, a bit behind primary care, maybe in some of these evidence-based practices. Sometimes care that's been delivered has not been evaluated or consistently evaluated. And then there's also issues around timeliness of services, like how long does it take someone to get in to see a behavioral health provider? And right now, this is a huge problem. And integrated care, presumably, if you had a team like what I just showed you, like you would potentially have providers like there, maybe not seeing people for long term, maybe they're shorter than 50-minute sessions, but definitely being available to see people because they're already integrated into part of the team, as opposed to a separate team, which might be really impacted. Continuity of therapy, and again, I'm not thinking that there are easy and quick answers to this, but integrated care has a potential to also increase some aspect of continuity and consistency of therapy as well. Certainly making it more efficient. And this idea of called consumer literacy, that the more access people have to care, the more opportunity they have to really learn about what behavioral health care is, what their options are, what are maybe some best treatment practices. Again, with behavioral health care being more integrated into the mainstream healthcare services, there's less stigma potentially as well, and just more opportunity to have these conversations. So I just have a slide here on models of integrative care, and I'm just going to check to see if I can, the chat box, see if there's any questions or thoughts there about any of this, people's thoughts about any of the things I'm talking about so far. So I have one slide in particular, and I have in the notes at the back where this is from. There's a couple of different models generally, and one is like coordinated care, which basically you still have your primary care provider, your behavioral health provider, pharmacy, whatever providers you have, and they're not co-located, but they're coordinated. So they have agreements, maybe MOUs, and they have a practice and a process of communicating with each other. Clearly can be done. In some ways it's helpful because you don't have to try to create these teams. But as you might imagine, it takes a lot of work for folks to be disciplined and roll into their practice, the calling and the connecting of each other. I do a lot of coordinated care just in my private practice, and it takes a lot of work. It's something I have to be really intentional about. It's not as easy as being able just to walk down the hall. It's something I would enjoy when I worked in county mental health, because everyone was right there. So it does take a lot of work, but just I think the intention and the goal to have more coordinated care amongst our providers is an excellent step in that direction, right? We're not going to have as many integrated care settings as we want immediately. It's going to take a while to build it. So this idea of coordinated care, I think, is in the right direction, changing the culture. And then we have co-located care, where we may have like different specialists all kind of working together and actually in the same environment, in the same building or buildings, and that makes it certainly much easier. So folks can not have to get on a bus or get back in a car to go to another doctor's office. That makes it much more difficult. And certainly the proximity, all this proximity is very helpful. And then integrated care is really more or less talking about where we're actually all teaming together. We're actually hired together. We're all on the same team, and we're in the same building, and we communicate, constantly about what it is that we're doing. And it's more seamless kind of care. Yeah. So Irene, you have a really great question about how's evidence-based practice use tracked. So I think I'd be interested other people who are using evidence-based practices in your organizations. Feel free to add how you do this. So it can be different in different organizations, but generally with evidence-based practice, there will be often a quality management or training team. Sometimes they're one and the same, that's in charge of selecting which evidence-based practices are going to be implemented for which concerns, right? So you need to actually have usually a toolbox, a number of evidence-based practices that you might be deploying and that you would be able to offer your clientele, and also be able to have the practitioners know about and be able to use. And so with that comes training, and not just training, but then fidelity testing to make sure that those of us who are trained are actually doing what it is we say we're doing, and outcomes are collected, et cetera. And there's an overview about where can there be improvement? Are the evidence-based practices that we're choosing, are they sufficient? Do we need to look at other types of practices? Does it meet all the particular needs of the organization, et cetera? So that's one way that it's tracked. It's usually through, I would say, like a quality management program or setting that's part of the administration. although everyone who performs the evidence-based practice, the providers are also committed to being held accountable for their training, for their continued training, for the practice, participating in fidelity studies, etc. So, hope that answered your question. It's a great question. And at the college level too, I'll just say this: it's an important piece to be thinking about, because there's an opportunity to start teaching students, say youth, but teaching students about these evidence-based practices, when they're in programs, right? So they already have a jump on it, really helps them, I think, in career opportunities as well, to be able to put on the resume that they're already starting to have training in, solution-focused therapy or certain types of cognitive behavioral therapies or whatever it might be, for instance. Okay. I don't know how many people are familiar with this. Maybe all of you are, but I want to just kind of show me how many folks are familiar with ONET Online. Just kind of curious with that. Maybe a bunch of you. Irene, you are? Okay, excellent. Just looking around the room here to see if other people are raising their hands. Nope, okay. Well, great. If you're not, that's good. I will go ahead and talk a little bit about this, which is perfect. And Irene, you may also have a question too, or you just raising your hand, just because I asked you to. All right, great, thanks. A question, I'll be happy to answer that too. But ONET Online is a wonderful resource. What it is, it's an enormous database. I'll show it to you. It's a wonderful tool for instructors, for workforce development folks, for students to think about what does the U.S. Department of Labor, what have they collected and what have they organized and what are they studying in terms of the community. So what they've done is they've taken all these job titles that's out there. It's just thousands and thousands of jobs, and jobs you don't even imagine that are on file at the Department of Labor, and they actually go through and look at, like, what do people have to do for these jobs? How do they train for them? Where are they used? Where are they deployed? How much do they get paid? And they've actually changed this, which I really love. They changed it to where they now give salary information, and they also give salary information regionally, which is really nice, because if you look at the average salary, and I'm talking to a student, and we're in San Francisco, and they see, a job for a counselor, they just immediately become terribly depressed because it looks terrible, because it's like, $40,000 more than they'd get paid here, right? And so they've adjusted it for different, all your zip codes. It's all adjusted for what you would get paid. It's an incredible data dump, really, of all this stuff and the way they've organized it. So let me show it to you. So what I did here, let's see if this works. Hopefully you can see this. Hope you can all see that. So what I did is I set this up to where I searched for integrated healthcare. And then what it did for me is it sorted out all these different occupations.
Okay, we can only see the careers in integrated behavioral health slide. We can't, if they're.
Oh, it didn't show up.
Yeah.
Darn. Okay, it didn't grab. Okay, let me try. I can stop my share and I can redo that. Thank you for letting me know.
For sure.
So I clicked that button, the ONET link, and this is where I ended up. Can you see that now?
Yeah, we got it.
Awesome. Okay, great. So the address here is onetonline.org. And so it brought me to integrated healthcare. And so I can see, like, here's all these different things. And this is not exhaustive, because I'm thinking, where are the physicians? So it's probably not a perfect search, but certainly gets me looking at this, and I be thinking with students about, hey, what kinds of things might you be interested in? And I do this with clients all the time. And what's also really nice is that they've got through the Bright Outlook, and the Bright Outlook, let's see if it shows this for you. Hopefully it'll keep showing my screen. So it says Bright Outlook, healthcare social workers, and Bright Outlook occupations are expected to grow rapidly in the next several years. We'll have large numbers of job openings in our new and emerging occupation, and you can get into more details. And then you can look at all Bright Outlook occupations. It's a great tool. It's really nice. I think that's very helpful for people to go through and be able to look at, wow, look at all these. And actually, I think almost all of the integrated healthcare, except for maybe occupational health and safety specialists, and patient representatives, although it's kind of interesting to me, are not right outlook, but that's nice to be able to see. Oh, thank you, Robin, for putting that in the chat box. Yeah, so let me do something like this. I'll see if it allows me to show it to you, but I am going to check in healthcare social workers. I'm just gonna click on that. There we go. Hopefully you can see this okay. It brought you to the healthcare social workers page, and it goes into details, all these different, you get Spanish for veterans, which is actually really helpful as well. Vets can kind of go and look at, see if there's any special opportunities for them. But what's nice is you can scroll down. This is really helpful for young, people looking at jobs for the first time, but also career changers, about what kind of tasks does somebody do. So you can scroll it down there. Okay, this is really helpful. Looking at technology skills, there are things I need to be able to know how to do. The work activities, detailed work activities or work context. They have training credentials, which is also helpful. So, okay, I'll select a state. I'm gonna put in my zip code here. I'm just gonna, what the heck, just see. Let's see. Oh, it tells me where I can train to be a social worker. Wow, that's cool. And it tells me, so you can, it's a wonderful tool. And then hopefully you can see all of this. Let me know if you can't. Then it talks about education. How much do you need to have? It gives you an idea of, what's this, master's degree. Okay, all right. And so you can see where all the different work values and styles. And so this is also important. It comes up for folks. So if we look at median wages, $29 hourly, 60,000 annual. Oh, that's maybe not so great. Well, let's wait. I'm in San Francisco. Let's see what this looks like. Let's see if this helps. But this does give you an idea, like how much more you get in San Francisco, potentially. Excuse me. And in California versus the United States. Like, oh, okay, that's a little more of a living wage. And that's just, again, just kind of a helpful thing. So I really love this particular resource. It absolutely allows us to really explore. So again, if you're thinking of helping people, think about, well, what kinds of jobs are in integrated care? This is a nice way to kind of start to see what's out there and then to drill down.
Yeah, I think you're spot on, just with like the amount of like preparation or like
Right.
schooling, education and stuff that's needed. Okay.
Yeah, and that would be a good thing, of course, for people to know, right?
Right.
So that's a very helpful thing, because we have people who, they don't want to go to school for forever. So you might be able to think, okay, let's just look at an integrated care. What can I get with like a community college training, for instance? Okay, you know what? My ability to search fast, quickly. So it looks like, job zone 1, occupations that need little or no prep, to some prep, medium, considerable, extensive. So you could actually just kind of pull that up and see what it says. 4 years bachelor's degree, some do not. This is actually really helpful. I'm glad you asked this question. Thank you. It's really helpful for advising, isn't it?
Yeah.
And helping folks think about that. Great. I'm going to, in case you find that helpful, I'm going to put that into your chat box. ONET, useful. I use it a lot in like when I do career counseling. I use it a whole lot. It's extremely useful. So now I want to get into a little bit about integrated health competencies. Workforce development nerd, I find this stuff just really fascinating. And again, with any job, any industry, we're always looking at like kind of the KSA. Sometimes we talk about KSA, about what's knowledge, the skills, and the values. So this is actually all from a really great article. I have it in your reference section. It's getting to be like 7 years old now. So as far as I can tell, these things seem to be very consistent with what I know about integrated care at the moment. However, it probably needs to be updated soon, just in terms of technology and how things change, jobs potentially change. So a few things I want to point out. So one thing that someone would need to have if you're working in an integrated care setting, again, thinking about this for advising purposes, career counseling, course development, is really this idea of like developmental psychology. Basically, I teach developmental psychology, so I really appreciate this particular aspect of helping people understand, a bit about early mental health, early trauma, early needs, the evidence-based practices like all through the lifespan, as well as the needs of older adults. And of course, it's all along the lifespan. People have different needs. And if you were an integrated health care provider, whether you were a behavioral health specialist or not, these would be really important basic things to know, because even as a physician, you're going to have to know some aspect of, okay, this is something I need to refer to someone else. I need to know a little bit about what is normal development and what is concerning to me that might need more assessment. So I won't go into read each and every one of these little details I go through, but you can kind of see on the list here, this idea of developmental needs across the lifespan, it's really critical. And there are some real concerns because, very early and very old people sometimes get lost in the mix of the kinds of things that we're looking at. And yet those are really important developmental areas, with the very young being the places where we can really help prevent a lot of further healthcare issues. On the very old, sometimes things get really missed. So we need to be able to do some assessment and be able to do some differential diagnosis and start to clarify. So this is a skill set for anyone in integrated care. The idea of being able to screen and assess efficiently and kind of quickly, and it's nice to have a team, because obviously, that's a whole lot of knowledge for any one person to have. But this idea of being able to screen rapidly to get an idea of where the next best place for an individual might be within the system. Being able to understand like comorbidities. This comes up a lot. My specializations in co-occurring mental health and substance use disorders. And that's a huge challenge as well, because we're always dealing with, what's occurring here. Is this the mental health challenge that I'm seeing, or is this the substance use issue? And sometimes we really don't know that, right? Until we have someone who maybe stabilizes for a while on maybe on a medication, or someone who stabilizes for a while because they've stopped using. And that occurs a lot in our integrated healthcare situation of really trying to figure out, the signs and the symptoms, what are maybe some of the multiple causes. We have to also be able to get a sense of someone's memory capacity, especially as they get older, and intellectual functioning. Being able to understand neuropsychological assessment, and getting an idea of, what might be more neurological in nature, more psychological. That's a really important piece. And also being able to understand, what's the level of care, because there's a number of people who can be seen just fine in the integrated primary care setting, but there are individuals who need to go into, say, residential care for maybe a substance use issue. Maybe there's some other specialized care as well they need for other aspects of behavioral health as well. I'm thinking of the intensive outpatient type programs, which are wonderful because they do help, I think, get a lot of services, intensive services out to the community in outpatient settings that are much more accessible and much more cost effective than residential care. So being able to maybe set up, utilize, be connected to those types of services as well. IOP. So IOP can be used around chronic challenging mental health challenges, as well as substance use concerns and co-occurring substance use and mental health concerns. What else do we do? So we also want to be thinking about effective evidence-based practices for the integrated care environment. So really, if you're thinking about being able to see folks for whole person care, no, we're not going to be doing like long-term psychotherapy. It's just not practical and probably not feasible in that environment. So we're thinking of brief and solution-focused treatments. So if you saw me last time, motivational interviewing is a really well-researched and very effective evidence-based practice for engaging people in care, helping people to make decisions around behavioral targets. It could be cognitive and affective targets as well, but a lot of it's very behavioral. So it helps for the psychological concerns that show up in integrated behavioral health, and it helps for the chronic kind of healthcare conditions that we often need to manage behaviorally. So it helps people identify what they can do to take care of their own health. Solution-focused therapy as well can often be really helpful in terms of this evidence-based practice that's appropriate for integrated behavioral health care as well. And the thing about solution-focused therapy and about motivational interviewing that they have in common that make them particularly effective in this environment And I think good skill sets to teach students in a lot of programs, whether it's nursing, whether it's occupational therapy, counseling, drug and alcohol rehabilitation, is that they can be used to engage people, and they're brief. They help guide people towards change. So they're not just psycho ed based, where we know a lot of people who are ambivalent or they're not really sure if they want to change. Like, to give them a lot of psycho ed when they're not ready for it can really feel like a waste of time, or it pushes them away from treatment. And yet we need to engage and to help move them towards change in some way, because if we don't, many of us would not move, be in our own inertia. So these guiding approaches are very helpful. Another skill set that's extremely important is our screening, referral, and linkage skills. And I say really important for everyone. So from the physician, should be able to have like some knowledge of this, even if they're not doing screening referral all the time, but to have that overall sense of how that's done and when that's optimal. But clearly, the case managers on staff, peer providers, the counselors, all folks can be involved in this process. And this is from our little video, right? Our little video with Wendy. You'll notice on the back wall here, see SBIRT, if you caught that. But SBIRT is a really widely used screening and brief intervention evidence-based practice that's been used, I think, for like the last 15 years, maybe a little bit longer. And they started to do SBIRT in primary care, not necessarily all integrated care, but many primary care locations, because what they're concerned about, again, a lot of this came from the Affordable Care Act and really identifying people who needed care earlier rather than later. And why they started to use the SBIRT is that there is a practice of actually screening for alcohol and drug use in primary care. Because what they find is that for alcohol and drug use, if we don't ask, people often don't tell. If it's not the primary reason for referral, people won't even mention it. Sometimes people don't think they have a problem. Why do you want to talk about it? Sometimes there's stigma around that. Sometimes, it's the nature of substance use itself. Sometimes is like, I don't have a problem. That inability to really assess oneself very well. So why would I talk to my doctor about it? And what SBIRT does is it has a provider. It could be done by a peer, it could be done by a counselor, it could be done by a doctor, and actually give a screening test for, say, like alcohol and drug use. And then based on the scores of that test, there's a brief intervention, which can be like, hey, I'm noticing that you drink, so-and-so a week. And then if it's not a lot of use, or if it's just kind of like some risky use, we do a little psycho ed. If you cut back by such and such, that really increases, your chance of having accidents and other problems by so-and-so. And what they finding in the research is that when a medical professional, especially someone's doctor, does that kind of brief intervention, it does directly impact people's use. People will cut back because people like their doctors, they trust their doctors. And if it's done in this way, that's just very matter of fact, non-judgmental, supportive, people respond. And then we also catch in the screen people who really need treatment. And again, a lot of times in our country, and I guess probably most places, really, people in drug and alcohol treatment are there because someone told them they had to go. Often. I mean, some people bring themselves in, but usually it's after a lot of consequences. And so SBIRT is trying to get this like upstream so we can get folks into treatment or encourage them to go into treatment before they have to go into treatment. Or, worse yet, before they have a, catastrophic issue or a big health concern and they can't take advantage of treatment. So that's an example of the kinds of screening we do. Because in integrated care, then you're doing screening on different things. Sometimes we screen, I do this in my private practice now. I screen a lot on depression and anxiety, and I keep, dashboards of how people are doing and can check back and, hey, it's going up, it's going down, how you doing? So I'm getting feedback that informs my care. Otherwise, it could just be like, what's the problem this week, right? But now I'm going to talk about it because I'm doing screens and I'm noticing there's been a big shift. So in integrated care, that's really important because you have a team And we're thinking about like this idea of differential diagnosis, what's going on. It's challenging when you have whole person health, and screening tools are really helpful because it gives us an idea of like, okay, this is not a problem. This is a problem. What direction to go into? Being able to refer, and again, for the places, especially that are not an integrated team, but maybe are coordinated, maybe even co-located, this idea of being able to refer back and forth between different providers and link them to care is really important because people get lost. They get lost in the process going from my office to someone else's office. So why it's so helpful to have it all together, but when it can't, linkage is really important, this idea of warm handoff. Again, these are all really important skills we could be teaching any student in healthcare. Evidence-based practices, we're working with folks with co-occurring conditions. A lot of co-occurring mental health and substance use conditions and physical health are based on motivational interviewing, absolutely. And then there's also co-occurring disorder like toolkits for helping people like manage various aspects of dysregulation, decision making, self-care, all these pieces that are really important when someone has a lot of health challenge to deal with. And I like this as well, helping to have a mindset, of when working with behavioral health as well about, how to help people have a life that's worth living for them, improving their functioning, improving their outcome, not just reducing the symptoms. So it's great if someone is hearing so many fewer voices per week, but are they actually enjoying their lives? Are they actually doing things that they care about, things that they value? By all means, let me know if you have any questions. Other things about this whole person care that we want to be able to teach people around. So here on this last page here, we're talking really about behavioral health care needs, but now we're looking at kind of whole person care. Thinking about like where are the barriers that sometimes come up for someone who is not getting whole person care. So I know I've worked in areas around mostly in the behavioral health kind of arena, but then there's places often where someone might need something like, say, physical therapy, and maybe it's not as easily accessible in my program. Like, how do I kind of help people get to that service? Again, motivational interviewing techniques is not just for behavioral health. I teach MI to a lot of other healthcare professions. Soon I have a big training next week with a number of doctors I've been working with in primary care, and I teach it to nursing teams and case management teams, because again, the motivational skills are helpful for all aspects of behavior, including medication adherence, including aspects of other lifestyle changes that are going to be helpful for whole person care, like exercise and sleep management, etc. Another important thing is we're thinking about how do we engage folks' families. So it's not just isolated individuals, but individuals in their context where they can get the most support. And I love this idea too about really thinking about how do we teach people to properly use behavioral contracts, things that people agree to. I like thinking about this whole idea of SMART goals, that idea of helping really being collaborative with people we work with around what's going to help you get what you need. How do we very specifically plan for that? And then this idea of really specific follow-up. I also do a lot of work around too, helping people when they leave their appointment, like helping them imagine like what they're going to do very specifically before they come back, and actually shaping their behavior. So when they come back to prior sessions, they become very attuned to and responsive to the fact that they owe me homework, so to speak. I don't make it sound that way because that sounds too much like school, but that they are expected, they're held accountable, but accountable in a way that I hope and I intend to be loving and curious about, hey, how'd that work out for you? And I really teach a lot of thoughts, lots of ideas around, there's no fail, F-A-I-L. If you didn't do it, it's not a fail in terms of you're bad, you flunked. It's a first attempt in learning. It's F-A-I-L. So anything that feels like a failure is actually part of the process of how we learn. So what did we learn from that? How can we, do something different? And that framing really helps, I find. This idea, yeah, that one, it's the FAIL really helps because there's so many people who get so ashamed of making a mistake or, not getting something done. And it's like, that's just all data. That's going to tell us what we can do differently. Again, self-management and skills around that, and any type of, practice that helps people regulate, manage distress, communicate with other people, just take some good care of themselves. Very helpful. Even like little small like doses of, of self-management work, distress tolerance work between sessions can be so helpful. And also just the education and this idea of being able to collaborate and care. So all of these pieces here about patient engagement, these could also be core competencies that can be taught to students, and they can practice. They can practice in vignettes about how do I do this? How do I make this work, regardless of what their major is, as long as it's a healthcare major. And then another thing to teach students and to really help people be aware of is how do we get involved in team-based care and communication. So again, I'm from a field that really taught us in a private practice model. And I work in private practice now, but I spent first 20 years of my career in public behavioral health. So knowing how to work as a team was absolutely critical, right? And I like working that way. And so I found ways to work that way. And I think people were training students, it's really helpful for them to have those skills. So it's interesting. I noticed now teaching counselors, we teach them how to collaborate and be part of like systems of care. That doesn't mean that they're going to do that. Some will still go and work privately. But even I think if they're in private practice, just knowing how to collaborate with other providers is still really important. So we know this is part of motivational interviewing, but it's increasingly a part of responsive and effective healthcare is like shared decision making and helping teach people how to collaborate with their patients. Noticing like other team members too, and recognizing the unique like scope of practice and contributions of each team member. Sometimes, maybe a lot of times, I think it depends on the culture, that people come in kind of that guild mentality. Sometimes people can get very tribal about their particular field, their particular practice, their license, whatever it might be, and really try to bring in a culture of respect towards other providers, and that everyone has something to contribute to the combination, to the issue, and that if someone has a different opinion, that doesn't make them an enemy, but that actually could be really helpful, could inform best practice. So I think just that attitude is really important, in addition to helping students and who'll be providers think about the soft skills, their own ability to speak thoughtfully, using iMessages, nonviolent communication, all those kinds of ideas, so people can negotiate and do conflict resolution. You don't see it on that little video, right? Everyone's getting along really well, and rolling around and just doing great handoffs and such. But the reality is that it's fast, high-paced work, and people do get on each other's nerves. So there has to be this ability to communicate effectively, clearly, and with respect. So teamwork is just helping them think of teamwork as an ethical practice as well, and then also being able to understand like how can we always look at our team as a growing, this idea, having a growth perspective and the growth mindset, that we can always be improving. We're doing the best we can. Maybe we're doing really great work, and we can always do better. Right? We can always do better. It doesn't mean that we're not doing well now. It just means that we have this movement towards. Okay, just have a few more slides, and I think that'll give us a chance to just ask questions, and be glad to explore some other ideas that you might have. So professional values and attitudes. So this gets back to what I was saying just now about helping people see the value of and the importance of providing integrated care, because it can be challenging, to say that. One does have to, as a provider, check their ego in a certain way. Like we're part of a team. We need to be flexible and adaptable. a primary care model might not be exactly like the counseling model I was trained in, or whatever, just using counseling as an example. And that's okay. I'm coming to this with a certain understanding of the fact that it's a model that brings in a lot of different professions, and it's not going to look exactly like a therapy model as traditionally has been taught, for instance. So with that, helping people understand their own professional limitations, what's my scope of practice, and that there's ethical issues unique to integrated care, in terms of we're a team that shares information. It may be different from private practice, where we're constantly creating boundaries and be very very intentional in a different way about how we share information. There's definitely thinking about access to care, potential legal issues that might show up. You know what Where does each team member kind of come from? What do they have to contribute? So I think I've been talking about this before, but in this idea, it's not just about skills for working as a team. What's different from this slide, from the last slide, it's really helping individuals bring up their values and be really clear about, is this the kind of work I want to do? And do I have the attitude necessary to collaborate with others and to be part of something instead of, maybe the only person or working in a very small group. And it's challenging too, I think, for some people to also have their work kind of looked at in the way that you really need to look at it in integrated care, because in integrated care, we do need to have a lot of very careful assessment about what are the outcomes and how are people doing, and are we making these outcomes? Because if we're not, we need to be questioning that. And that takes humility. That takes some cultural humility, intellectual humility, just to be able to look down and say, yeah, you know what? I didn't do this in a way that was really that helpful. How can I improve? And then in this process as well, we have to learn how to trust each other and trust each other's decisions. It doesn't mean we don't call things out that we think is improper, but we have a way of doing that that's really respectful, and that we ultimately, have more trust than suspicion of other folks on our teams. So I think this is really important for training a future workforce. They're really thinking about these ideas of how do we work together, sense of collaboration, shared decision making, and kind of ego checking around some of this. So I'm interested in your thoughts about this as we finish up. And then I think one of you kind of brought this up earlier in the chat box. We also have systems level needs in terms of the integrated behavioral health. So there's always going to be a challenge, as I said before, about this idea of flow. And there's always something, creating some sort of issue. It could be some aspect of staffing imbalances. It could be a new technology. I find a lot of times like new compliance issues, like something will come up and someone has to now fill out a particular form at a certain time in someone's process getting through the clinic. And that can really hold things up, right? If you have a doctor who now has to do something, and we know adjusting to electronic medical records in the last 10 years has been really hard as well, as far as flow goes. And for different people in the teams, they have more or less impact with those electronic medical records. So these are all things that systems level needs an administrator is like always working on. Then with administrative leadership, there need to be able to figure out like what's the mission and vision of this organization, and making sure that what people are doing every day is it working with the mission and vision, or do we drift from that some of our practices? How do we get back in? And there's a lot of work that goes around financing. As you can imagine, billing is a huge piece of this, especially the way our healthcare system is set up. We don't have clearly we don't have any kind of national healthcare kind of funding where you just get paid. You have to really be able to be very sophisticated about how are the payments coming in, and where can I maximize payments, Where are things that we're doing that are excessive that we don't need to be doing because it's not financially feasible. And we got to make those decisions. If we're cutting or adding something, why are we doing it? It really ultimately is in the best interest of the people we're serving, which hopefully would be the best interest of our vision and mission. And then there's the idea of operational support. So the operations, and like I said before, and the flow, critical on these teams. It's make or break. It's a real challenging piece. So making sure that we have enough people dedicated to being able to observe this. And here's where it helps to have, without being too administration heavy, but it helps to have people who know things about not just clinic flow, but quality improvement, being able to come in and test things, making sure that things are working so we can, make decisions that are data-based, about how to best distribute staff, how to best distribute evidence-based practices, when to apply certain evidence-based practices, what's the best use of space, what's the best use of, various technology. And also, there is this idea of like practice culture, where people are performing practice, people are in practice, but with that comes a lot of like communication and training about what the particular culture of the agency is, and really training people and retraining people on the various practices. So in integrated care, again, if we're looking at evidence-based practice, we're always looking at ongoing training because there's staff turnover too. That's another thing. And as someone who does a lot of training and evidence-based practices, a big piece of how I contribute to practice culture is helping people, do deliberate practice, to not just talk about kind of what they're doing, but to actually practice the skills and to get coaching and feedback. So that's where people get better, is with coaching and feedback. And kind of related to this, kind of added this in because it is so important, is the idea of continuous quality improvement. So it's always finding like a place to do a performance, improvement protocol. There's always some aspect to PIP, right? And it's having some aspect of external quality review, potentially internal quality review, to make sure that really keeping the ethical practices in place. But we're also just doing things as efficiently as we can, because again, it's a lot of moving parts. It's a lot of moving parts to make these things happen and to make it happen efficiently. I think it's a really exciting place for students to potentially explore and to train in. One of the things I like to talk to students about a lot is like, these are almost always like real recession-proof jobs. And these last couple of years have also certainly put a lot to test. There's some people who have clearly and understandably have burned out, and so that is an occupational hazard. So the self-care and all of this is really important, and the community care is really important. And then for some people too, having a crisis like pandemic or environmental crisis or what have you, just gets them more activated. I mean, they are by nature first responders. So, we might have some people we work with who are just more likely to really engage in this kind of work. So they just find the meaningfulness of it's really compelling. And it can be very meaningful because there's just so much, that's done as a part of a team. You get to see people in a way when you're providing whole person care and they're able to participate in their care, that is really empowering. So I have a few references I put on here. These are actually references that I used for the article. So the diagram I gave earlier to you of the different models of integrated care is from this Brown article. The Kidman article here is the competencies I just reviewed. And then the quality improvement in behavioral health, that's where I got the information about some of the deficits and troubles we have with behavioral health systemically. And there's that quote I had in there about ways of reducing costs from Siegman and Hilber. So it's not my share here. I actually have enough time to be able to do a few questions. If people have questions for me, thoughts, feedback, about any of this, next steps. Hopefully we were able to touch on some things that were really helpful for you in terms of integrated care.
Wow, there's so much that is going through my mind, but I think one of the things that stood out for me is I don't think I had really ever broken down the three components and the differences between coordinated care and integrative care. And now, of course, the third one is skipping my mind. But so those are really good things, I think, just to know in general. And then the other piece is, I guess, what, or I don't know if you know this information, what kind of level setting are they getting at clinic sites as far as the integrative care approach? Because I've worked in a clinic that we had an interdisciplinary team approach. So we would all visit with the patient or the folks coming in to receive care, but I'm not sure how much orientation they got, because they're seeing a social worker, the nurse, the dietitian, the physician, all in one visit.
Right.
So again, and then I was never really trained. It's just like, oh, you're the social worker now coming to work. And so anyways, just wondering what kind of top-down approach are folks getting as far as understanding what it means to be in that kind of team setting. And you did mention the integrate or constant retraining and orientation, but just wondering from top down, now that we're really moving with CalAIM towards an integrative approach, do you know what's happening at that level?
I don't know some with CalAIM in particular in terms of some of those details, but your just example, if you will, really brings to light kind of different ways that the providers try to do what they can around this. I mean, I think that's part of also what comes up is that we have like these like integrated behavioral care kind of ideals, and there are definitely some programs out there that are like textbook examples, are just really doing wonderful, like Cherokee Health Centers, that just have been models for years of kind of amazing integrated behavioral health. But I think the reality is that a lot of programs do what they can, and sometimes end up having to cobble some aspects together. So, I mean, my understanding is that a lot of places are really trying to push toward this idea of having, teams like this. And yet it might be where people are doing what they can. Like there might be a integrated behavioral health team, let's say, in a hospital system, and it's just one team, but it's not yet the whole hospital. Right. They're just getting started. And I'm seeing a lot of that happening, or just these kind of places where people are trying to make it take hold by doing just like little pieces of that. So hope that answers your questions. But what I do like about, this idea of competencies is that if we're training or thinking about this, is to train to some of these core competencies, because I think they're going to be useful no matter where the healthcare worker of the future ends up, because it is going in this direction. And this idea of doing collaborative work, even if someone's not co-located, or if they're coordinated but not yet co-located, that can actually be really important. So I hope I answered that for you.
Yes, it totally makes sense. I definitely can attest to the cobbling together. But yes, I hope that there is going to be some standards, not just standards of how we provide the care, but as you stated, just standards and scope of practice. All those things will hopefully shift in the near future. So thank you.
Great, thanks. Great. Anything else? There comments folks have? I am certainly glad to stay on for a few more minutes if people have other questions. And I think Robin has a evaluation slide here, which is really helpful for us. It's self-explanatory, but yeah, there you go. You also got it in the chat box.
Yeah, sorry, I was typing the URL in. You should be able just to hold your phone up and with your camera, and it will take you right to the evaluation. If not, you can click on the link. And I'm also going to send this out to get the people that had to get off early. So you'll get it in an email along with the PowerPoint handout.
Great. Thank you so much. So well, I do appreciate everybody being here today on a Friday, taking the time out to show up.
Thanks, Robin. I'll ask another question.
Great.
Do you know how many, or have you had much interaction with the undergraduate level programs or even graduate level programs about this integrative care to approach, meaning like other trainings that you provided, or other folks interested in the work?
Well, mostly because I'm more involved in the grad school level. And one thing that has been very helpful for us, and it's more helpful really than anything, is just to have providers provide some sort of training for students in an integrated model. And that's not always going to be easy to come by because like we're finding I guess HRSA is starting to do from SAMHSA is starting to do some like funding for your various universities to send like students out to be interns in integrated settings, which is wonderful.
Okay.
Like that's really motivating for students to get internships. But the challenge I think some of us have had is actually finding places that actually have internships. And I know where I work right now, we have a nice partnership with a large hospital system in San Francisco that provides a number of internships for our students. And that it just really makes all the difference because when students get in, they get to be in a hospital setting and get to do behavioral health in that environment. So for people who have chronic illness, disability, stress, and they get to learn all that developmental concepts and differential diagnosis concepts and brief interventions. It makes a huge difference, right? Really expands it from the theoretical to like, what does this look like? And they get to be in that type of environment